Every hour in the United States, 38 people have an out-of-hospital cardiac arrest. Most of those people do not survive because they do not receive CPR. If the victim lives in a predominantly Hispanic or African American community, their chances for survival are even worse.
The hands-only CPR training program excited me for a number of reasons. I love getting to know the community, and there's no better way to get to know your own community where you live than to tell them that I care about what happens to you and your family. When you present that message, everybody understands that that's what you want, they're very impressed, and they will work together to make this sort of a project happen.
The rewarding part for me is knowing more people are being trained in CPR, and I think that's what we're all going for, more survivors. With every study that we do, we're seeing we get better and the community gets better. But I think this program can take roots and grow on its own to where it's a sustainable project.
By using community-level data, including cardiac arrest locations and census data to identify high-risk neighborhoods, we can provide targeted CPR education and training for those who need it most.
A lot of people do not understand the differences in survival rate between communities. There's a massive need for relevant resources in Spanish, like hands-only CPR training in community services and centers like this church. My hope is that by us training our church and the community in hands-only CPR, we can save someone's life.
By focusing resources on high-need areas, the Hands-Only CPR program will help families and will make a significant health impact.
The Hands-Only CPR study allowed us to go out into the community and affect thousands of people that might not be able to have the ability to do that on their own. You have a one-on-one with a person and you have that moment to make a difference in their life. We've given someone the opportunity, the knowledge to save that person, and you can't say enough about that when you give the tools to empower an entire county.
The American Heart Association is committed to meeting people where they are and tailoring CPR training resources to each high-need community we're working with.
In conjunction with the American Heart Association, it's such a great program because they're giving us the tools and resources to be able not only to enhance what we're doing, but also to be able to teach the citizens hands-only CPR. So if we empower the citizens to know how to do CPR correctly and quickly, we'll be able to help each other and be able to save a life. Ultimately, that's what we're doing because we want to help save lives.
Where you live should not determine whether or not you survive an out-of-hospital cardiac arrest. Together, we can find a solution.
Decreasing the disparities in survival is why.
Empowering our community members is why.
Unity is why.
Life is why.